Okay, so hi everyone, thanks for joining us today. As you know, this webinar is part of the Provincial COVID Rehab and Allied Health Provider Education Series. Today we will be discussing the topic of psychological, social, and spiritual considerations after COVID-19. My name is Laura Bernard, and I work with the Allied Health Professional Practice and Education team, and I will moderate the session today. We are very excited to have such great interest in these sessions. Because of the high number of participants, we ask that you please keep your audio lines muted. Please use the chat function to type in any questions. You can find that at the bottom of your screen near the middle. Please use a direct message to questions, and I'll send a message to the group from that name in the chat. I will collect questions and bring them forward at the end of the session. Please note that this webinar, along with the question and answer period, is being recorded. Recordings will be posted on the internal AHS Allied Health Practice Hub, as well as on the external Recovery and Rehabilitation After COVID-19 page, and I'll add those links in the chat box shortly. AHS employees will be able to find the handouts to this session on the AHS Allied Health Practice Hub link. This webinar series is open to all healthcare providers. These sessions are focused on the biopsychosocial and spiritual perspectives of post-COVID rehabilitation and recovery. You are encouraged to tune in to as many webinars as possible, as we believe that each session will be an opportunity for new learning. The companion clinician resource is seen as a living document and will be updated as new information or content becomes available. I'm pleased to introduce our speakers today. Lana Hawkins, Practice Director, Provincial Psychology. Zinnia Pritchard, Practice Director, Provincial Spiritual Care. Andrea Oifer, Professional Practice Lead for Social Work with Covenant Health. And Deborah Fraze, Professional Practice Lead for Occupational Therapy for the Calgary Zone. Just a reminder of our copyright, the information provided in this webinar is intended for an AHS audience. Other staff groups may find the material applicable, but are responsible for aligning it with their own clinical policies and procedures. Every effort has been made to incorporate the best current evidence and information available. However, please keep in mind that information and new evidence, particularly regarding COVID-19, emerges frequently. If you have any questions or concerns, please email practice.consultations@ahs.ca. We acknowledge that we are gathered virtually today on the territories of Treaty 6, Treaty 7, and Treaty 8, and Métis Regions 1 through 6. These territories are home to many Indigenous peoples, including the Blackfoot, Cree, Dene, Suteo, Ojibwe, Stoney, Nakota Sioux, and Tsuut'ina peoples, the Métis Nations of Alberta, and the 8 Métis settlements. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to moving forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. And with that, Lana, please go ahead.
Thank you so much, Laura. So I just want to really begin with a big thank you. Thanking all of those who made such great contributions to this presentation and have helped advise us as we navigate through this area and weaving together all of the information to bring forward to you today. So thank you to Carmen Lazarick, Dr. Stuart Longman, and to Deborah Samick. And also just really want to thank the very many people, I guess, that we've reached out to and who've helped inform our thinking and our work and this presentation as well. So, and many resources that have supported us too. So just wanted to be sure to acknowledge that and extend our thanks. Okay, so our hope today is that we can offer you some really valuable information to support you as you strive to best meet the needs of your patients and families in your professional practice. And in our session today, we plan to highlight, why it's important to take a whole person perspective when we're working with post-COVID patients and families, the key psychological, spiritual, and social considerations that we wanted to bring forward to you, to provide you some tips to help inform your practice, and then using a case example, illustrate how a holistic approach that weaves attention to the psychological, spiritual, and social considerations can occur. So first, let's visit what we currently know about post-COVID and its impacts. Most people who have coronavirus disease recover completely in a few weeks, but some people, and even those who have mild versions of the disease, continue to experience symptoms for some time after their initial contracting. And this has been referred to as post-COVID syndrome, long COVID, and at times those affected have been termed long haulers. These health issues are sometimes called post-COVID-19 conditions. They've generally been considered to be the effects of COVID-19 that persist for more than 4 weeks after having been diagnosed with the COVID virus. So some of the common signs and symptoms that occur over time and can linger include fatigue, shortness of breath or difficulty breathing, cough, joint pain, chest pain, issues with memory and concentration, sleep problems, muscle pain or headache, faster pounding heartbeat, loss of smell or taste, depression or anxiety, fever, dizziness when standing, and worsened symptoms after physical or mental activities. So in any health context, the importance of addressing people holistically can't be overstated. The World Health Organization highlights that functioning, disability, and health are interactions between health conditions and contextual factors. So the contextual factors include both external environmental factors, such as legal, economic, and social factors, as well as internal personal factors like gender, age, coping styles, past and current experiences, personality, and behavior patterns, among many others. Within AHS, it's important that we recognize the role of the psychological, spiritual, and social considerations in health and patient care. And we see this reflected in many of our foundational frameworks and strategies. So for example, the rehabilitation conceptual framework emphasizes that people are at the center of rehabilitation at AHS, and that quality rehabilitation comes from professional practice that is person-centered, holistic, integrated, and guided by evidence, and that rehabilitation enables and encourages people to identify, reach, and maintain their cognitive, communicative, emotional, physical, psychological, social, and spiritual health goals. Our patient first strategy speaks to the importance of addressing what matters to our patients. And as people, patients have things that matter to them from a psychological, spiritual, and social needs perspective. So in attending to these needs as part of a holistic approach, we're so much better able to meet our goals and their goals, and provide patients with and families with the best possible healthcare experiences and care. It's always important that we look to research and evidence to guide our practice. And it's noteworthy too, that in their COVID-19 rapid guideline on managing the long-term effects of COVID-19, the need to adopt a holistic person-centered approach to clinical assessments is explicitly identified. So you'll see here that it states clinicians making assessments should take a holistic, person-centered, and empathetic approach, and that a carer or family member may be involved for patients who would benefit from support. The assessment should encompass physical, cognitive, psychological, and psychiatric symptoms, as well as functional abilities, and the impact on an individual's work, education, well-being, and any social isolation should be assessed. It's also noteworthy that, much remains unknown about the course of the illness, and patients have reported a wide range of symptoms of different and fluctuating severity. And many have reported dismissive behavior from some healthcare professionals. So it's important then for clinicians to keep an open mind during assessment and listen to the patient's story. So we often hear about the pandemic and the pandemic impact on mental health, and that it's been tremendous. And this is certainly true. How we're doing is very much related to what happens in our environment. And being faced with a pandemic and all that that entails is very much like pulling the rug out from under our feet. We have all had to cope with the threat to health and life, hearing of increasing unfathomable numbers of lives lost and families impacted, changing roles and responsibilities, the loss of many of our usual sources of support and coping, and an overall sense of uncertainty over the future and what's to come. So it's important for us to be aware, both for ourselves and for our patients and families, that we may be stressed or even traumatized, and for this to inform how we approach our professional practice and deliver care. But it's also important to remember that a pandemic situation is abnormal. And in the context of living in an abnormal situation, it's normal to feel things that aren't normally felt. And that research tells us that for the most part, we as people are strong and resilient and generally have the skills that we need to cope and manage. Overall, it's important not to assume how people are doing or how they're feeling or what they need, but important to ask. So it's also important to remember that not everyone experiences the same event or circumstance in the same way, and not everyone experiences or shows their distress in the same way. It follows too then that it's important to not assume what people need, but to consider their individual situation and their perspectives, and then working within your clinical judgment, consider options and perspectives, and then with the patient and family from there. So for example, not everyone who's exposed to traumatic event needs or wants an intervention. And we know that in some cases, this can actually increase the risk of psychological harm. It's important too to be aware that culture, gender, and other factors play a role in our experiences and our psychological needs. So it's important to look at the evidence and clinical guidelines, as well as to consider a patient's experience, symptoms, and preferences when considering if and what forms of interventions or other aspects of care would be recommended or considered best practice. So psychological wellness in any context can be supported by some common factors. And some of these include taking care of the basics in terms of healthy nutrition, regular exercise, and good sleep. Making efforts to ensure that we can keep our good, healthy connections with family, friends, coworkers, and connections in the community is also essential. Humans are social beings, and disconnection and isolation can contribute to mental health issues, and loneliness has a role in both depression and suicidality. It's also important to engage in meaningful and pleasurable activities and see what we have some control over and impacts in ways that are important to us. And attending to our stress levels and using stress management strategies is another way to help minimize anxiety and support positive mood. Some examples of some helpful strategies include focused breathing. So this is where you might slowly breathe in for the count of 4, and then hold it in for the count of 4 and breathe out slowly for the count of 6. This allows our bodies to recalibrate and lower our levels of physiological arousal. Another example is practicing mindfulness. So really paying attention to yourself and your surroundings in the present. And mindful meditation. So setting aside 5 minutes to just sit and breathe and to focus on the present. And if thoughts should intrude, acknowledge them, but then let them go. It's also so important to do things that bring us comfort and joy. Next is healthy thoughts. So one of the most research-supported treatments for stress and anxiety is cognitive behavior therapy, or CBT. And at the root of this therapy approach is the understanding that our thoughts influence our emotions, which in turn influence our behaviors. So reframing our thoughts around a stressor can really help us manage our emotions and reduce our feelings of stress. In your work with patients and families, the very same strategies that you can use can also be used to support your patients and families. It's important to recognize, right, that our own psychological wellness is a significant factor in our ability to help others. When we're feeling stressed or otherwise unwell, we can be less attuned, less sensitive, less empathetic, and are challenged to provide our best care. So self-care now is more than ever critical for healthcare providers. So it's not a luxurious indulgence, but really can be seen as an ethical imperative. And reflecting and integrating self-care into our routines is not only good for us, but a professional responsibility as well. The first step begins with monitoring your emotions and stress levels and how they are affecting you. And as you engage in your work, you can support your psychological wellness throughout the day by regularly reflecting on how you're feeling and your needs, and doing what you can to respond to your needs and reduce stress. So this can include things like taking regular breaks and keeping hydrated and eating well. Keeping a positive attitude. So remember, you are doing your best, and try not to let worries or negative thinking get a hold of you. It can be helpful to ground yourself. So to do a quick scan of your body and notice what's around you. If possible, close your eyes and focus on sensations, textures, temperatures. Focusing on physical surroundings helps us be more attuned to details and make more balanced assessments. So, for example, you could try saying these things to yourself. List as many things as you can see in the room, and then do that. Or list as many colors as you can see, and do that. And you can also take time to celebrate yourself, to slow down and recognize even small successes. This helps us feel more in control of our environment. And it's important to be gentle with yourself. We can't be perfect, and we can't expect that of ourselves. But we can encourage ourselves and our patients to do better and learn from our mistakes, but not beat ourselves up for not being perfect. And in our work with patients and families, striving to really create a caring, empathetic connection that is genuine, really attuned and inquisitive as to how they seem to be doing and feeling, and facilitate their use of psychological wellness strategies and encourage healthy thoughts and behaviors, as well as to respond when you see signs of possible psychological or behavioral health issues. So we know that if we pay attention to the psychological factors, this can be so tremendously helpful to our patients and families. It can help them to feel cared for and understood, and feel hopeful that the situation will improve. It can help them believe that they can do what they need to do and do what they need to do to maximize their treatment and health outcomes. It can optimize their ability to move forward and grow, to improve sleep, to improve pain management. And again, always important to keep in mind that there may be a need for referral. And so to be attuned to what you're seeing and what they're saying really allows to that facilitation of appropriate referral to occur. So there is a need to be mindful that for some patients and families, there may be a need to support them with resources to improve their psychological wellness, or in some cases refer for assessment or for treatment of a psychological condition. Research tells us that the pandemic environment, and even more so the experience of having contracted COVID-19, has increased the incidence of new, reemergent, or exacerbated psychological disorders. And the most commonly identified are depressive disorders, anxiety disorders, and post-traumatic stress disorders. However, other diagnoses may be present as well, including delirium and dementia, for example. And after hospitalization, up to 60% of patients may show cognitive impairments, particularly with memory and processing speed. Anxiety, depression, and other psychological disorders and symptoms are caused by the virus itself, the body's immune response, prolonged immobility, and certain sedating medications. So in their work, psychologists work to assess, diagnose, and provide evidence-based interventions for psychological and cognitive disorders, to work with patients to help identify thought, feeling, behavior patterns that exacerbate physical symptoms, and support patients to increase their ability to engage in healthy behaviors and obtain effective treatment. So some key psychological considerations are really to facilitate the patients telling their stories, being very aware to listen, be attuned, hear their words, and be inquisitive, to ask questions about their needs and things that they may be concerned about, to consider the ways in which their lives may be changed and opportunities for them to to acknowledge and grow and find ways to feel sense of control over their environment, the ability to do what they want to do, what's important to them and what matters. So really that opportunity to identify those ways to build meaning and joy into their lives and capture all of those great things that can help them move forward as they go through these challenging times. And we are so aware that even in the context of extremely difficult circumstances, we do have this great ability as humans to be resilient and to grow even from them. And so just really being attuned to that is so important when working with our post-COVID patients and families. So I wanted to highlight just a few selected resources. There are so many. But here are a few that you may find helpful. We will be sharing some more resources at the end of the presentation as well. And I wanted to touch base just quickly around this one that has been, I think, really helpful for a lot of folks to share with patients and families. And this is produced by Addictions and Mental Health in their Mobile Tools to Promote Mental Wellness resource, which provides some really important phone numbers to where to contact if you're feeling stress or distress, but then also highlights some free and evidence-based apps to try that are really based on good, solid psychological science and incorporating those aspects of cognitive behavior therapy and other techniques that we know have been supported so well to support people in reducing stress and anxiety. So with that, I will turn it over now to Zinnia.
Thank you, Lana. Welcome, everyone. So the COVID-19 pandemic has also had many spiritual dimensions. Spirituality addresses sources of well-being, needs, and issues that are related to the spiritual attributes, meaning, values, transcendence, connecting, and becoming. As we know, the pandemic has touched on all of these spiritual dimensions of our being. Questions of meaning have surfaced, restrictions that have challenged our patient-centered values and caregiving, disruptions to belief systems, and opportunities to connect, as well as impacts on growth and development. These experiences may be understood as signs of spiritual distress. If you could please move the slide to the next one, please, Lana.
Sorry, I'm trying to move the slide, but it's not working for me.
Okay. Shall I take over the screen and try?
Yeah, please do. Thank you.
Thank you, Lana. Oops. I'm going to share. Let's just see if we can you see the screen? Can people see the screen?
Yes, we can see it, Zinnia. Thank you.
Thank you. Just wanted to check before I continued. So, yeah, those challenges may be understood through the lens as spiritual distress. So drawing upon the evidence base, symptoms of spiritual distress may be identified through the experiences of loss of meaning and connection in relation to ourselves, to each other, and to what each of us may understand to be ultimate or transcendent, whether that be a philosophy or belief, nature, the universe, or a deity. Loss of meaning and connection with self. One symptom may be the loss or diminished sense of self. For example, a patient may share the following with you. I don't seem to be able to cope with things. I normally can cope with things. In this example, this patient has the ability to cope when he is in his normal sense of self. A once healthy and high-functioning, self-sustaining individual is now experiencing an unraveling of his sense of self. This example also reflects another symptom of spiritual distress, which is the feelings of helplessness or powerlessness. In the loss of meaning and connection with others, one symptom that has been expressed throughout the pandemic is the sense of isolation and/or abandonment. We have encountered many expressions. Among these are patients who have expressed the feelings of social stigma, the stigma of getting COVID, the stigma of not receiving a vaccine, stigma of not being seen to care for a loved one with COVID because of fear of contracting the virus. For example, a patient has said, I have been 3 weeks without a symptom and I'm off isolation, but my partner still feels uncomfortable to visit me. In the loss of meaning and connection with other, what one considers ultimate or transcendent, one symptom that again many have encountered is the question why. This unanswerable question surfaces in many forms. Why did this happen to me? It should not have been me. It should have been me and not my son. Why didn't this happen to me? There may be remorse or guilt and also anger towards self, others, and for those who believe in a deity, expressed anger against God. While spiritual suffering and the attending grief in response has been a marker of the pandemic, so too has been the experience of hope, of finding new meaning, new ways in which to connect, new ways to nurture belonging and life-affirming practices, and has brought the opportunity to stop and to reflect, to reevaluate and to reprioritize with insights into what is most valuable and what is most deeply sustaining for one's life. This paradox of holding the tension of both grief and hope is actually a marker of any depth experience. When spiritual distress related to loss of meaning and connection is not intended to, people have been known to fall into hopelessness. Some spiritual considerations to support ourselves and our patients and their families. Acknowledge that the experience is living one of compassion. A couple of quotes that help us to frame compassion. Compassion literally means to suffer together. Among emotion researchers, it is defined as the feeling that arises when you are confronted with another suffering and feel motivated to relieve that suffering. Compassion asks us to go where it hurts, to enter into the places of pain, to share in brokenness, fear, confusion, and anguish. Compassion means full immersion in the human condition. Self-compassion. There's an invitation for us to recognize what keeps us in an emotionally regulated space, referred to in trauma-informed care as the window of tolerance. Recognizing emotional triggers, traumas, and what drains us, and our need for self-care. Self-compassion is one response, perhaps the response of it's okay to not be okay. And other spiritual practices and self-care strategies are also expressions of self-compassion that can help us increase our spiritual resiliency in maintaining that window of tolerance. Compassionate care. Allow our patients the space to share their experiences with you. Listen, be present in the moment, acknowledge pain and suffering, and try not to minimize sorrow or to find a fix. Lament. This is listening to patients' expressions of grief as well as their desires and what they still have trust or confidence in and where they may be giving gratitude. Practice being in the present moment. As an antidote to anxiety, consider developing the spiritual practice of being in the present moment and engage other spiritual practices. You may consider engaging any one or two that you can draw upon, or there may be others that you may not be aware of that may support you in living with uncertainty and building resilience. These may include self-compassion, as mentioned, a practice to help us to be kind and caring and understanding of ourselves. It can help us cope in tough times and helps us to show kindness and compassion to others. It improves our mental health and well-being and improves our life satisfaction and happiness. Gratitude is a practice that can help us focus on what we have rather than what we don't have. Practicing gratitude can improve overall sense of well-being, promote positive thoughts and feelings, strengthen relationships and sense of connection with others, and increase our spiritual awareness. Lament, as referenced, is a spiritual process to attend to our own suffering and the suffering of others through the expression of grief, desire, trust, and gratitude. Practicing lament in tough times can help us shift from what has been referred to in the evidence base as unbearable suffering to bearable suffering. It can help us express our emotions without judgment, help us to know that we are not alone in feeling this way, and close that existential gap. It allows us to engage with our inner suffering, and it allows us to give voice to our questions. Breath meditation is an awareness practice that helps bring us back to the present moment. This practice can help us develop a sense of grounding and connection, improve concentration, decrease anxiety and depression, and improve overall sense of well-being. Contemplative reading is a practice that opens us to deeper connection and meaning through reading short pieces of inspirational or sacred texts. Finding the feeling is a practice that helps us recognize, experience, and understand our emotions. It can help us become more comfortable with experiencing the strong emotions. This practice can also assist in building emotional resilience. Labyrinth walking, and for some, there are labyrinths on some sites in AHS, and some communities have labyrinths. Walking the labyrinth can help us to be in the present moment. This is a single winding path with one entrance that leads to a center and back out. One can never get lost following the labyrinth path. This practice can help us feel calm, focused, centered, and connected. Other benefits of walking the labyrinth include feelings of calmness, relaxation, improved focus, and reduced anxiety and stress, as well as insights. Mantra is a spiritual practice in which a sacred word is repeated over and over, a word of your choice. It is a form of meditation that can support spiritual wellness and coping, and connect us with what is meaningful for us in our lives. And finally, taking and sending, another example of a spiritual practice, can help us in seeing and acknowledging painful situations while creating meaningful connections with others. This practice can help us to find courage through a deep sense of connection when we feel uncertain. In doing this practice, we may begin to feel care and love, both for ourselves and for others. I'd like to leave us here with an opportunity to highlight interprofessional spiritual health resources, and also to highlight that among these interprofessional resources are many practice-wise webinars that look to compassion, self-compassion, and spiritual practices. Of course, as with others, if complex spiritual distress presents, if people are in prolonged and chronic spiritual pain, please consider referring to a spiritual health practitioner who will have an opportunity to comprehensively assess and to provide the necessary interventions, whether they be ritual-based, practice-based, or psychospiritual therapy. These are the list of our practices also available. I'll now pass over to Andrea to take us to social considerations.
Good afternoon, everyone. I'll just try to share my screen here. Thank you. Apologies as I scroll through quickly. Okay, thank you everyone for your patience and good afternoon. We'll shift a little bit and begin a discussion about social considerations as well as social impact. Now, there's no doubt that the COVID-19 pandemic has affected everyone in some way. There are many social considerations and potential impacts that should be considered along the healthcare journey or the journey in general throughout the pandemic. From a patient and family-centered approach, these considerations and impacts may affect not only the individual patient, but also their family or household members, as well as caregivers. Furthermore, from a person and environment perspective, it is important to acknowledge that the individual and their behaviors are intricately connected to and impacted by their environment, which includes where they live, access to resources, and social connections. In the following slides, some potential social impacts and considerations will be reviewed in more detail. To begin, we'll look at health equity. So the pandemic has shone a light on the social determinants of health and health equity. Let's begin by focusing on health equity and what it is exactly. Health equity is when all people have the opportunities they need to reach their full health potential and are not disadvantaged due to social, economic, and environmental circumstances, which are determinants of health. The pandemic has affected all segments of the population, but has been particularly detrimental to members of those social groups in most vulnerable situations, and continues to affect populations, including people living in poverty situations, older persons, persons with disabilities, youth, and Indigenous peoples. Early evidence indicates that the health and economic impacts of the virus are being borne disproportionately by people living in poverty. Thus, health equity is impacted by social determinants of health, and likewise, social determinants of health impact health equity. So if we look now at social determinants of health, what are these? Social determinants of health are personal, social, economic, and environmental factors that impact one's health. These factors can include physical activity, stress levels, social connections, accessibility, for example, transportation needs, and employment and working conditions. Furthermore, one powerful and essential social determinant of health is income. The amount of income one has enables their ability to access resources and materials needed for good health, such as healthy food and good quality shelter. Income can also influence the ability to access services that improve health directly, such as leisure activities, medication, and non-insured health services like dental care. Income can also influence access to opportunities that improve health indirectly, like education and social networks that allow one to participate more fully in a society. For example, accessing the internet, owning a phone, and attending social outings. Thus, from a post-COVID recovery perspective, it's important to acknowledge the impact of COVID on a patient's financial status and security. I'd invite you to consider the following from a social impact perspective. Has COVID impacted the ability of your patient to work? Will they have decreased work hours? Or perhaps are they unable to work altogether? Or perhaps it's an unknown amount of time, or perhaps indefinitely. Those are big questions, and maybe there aren't the answers needed at this time. As well, what impact does this have on a patient's ability to access health services? And what impact does this have on the patient's mental health? Asking questions about social determinants of health, and in particular, income and financial strain, can inform intervention plans, including providing support as well as pertinent information on potential resources and referral options. Now, another social impact is social inclusion, and specifically to digital transformation. Now, this inclusion can also be exclusion with respect to the digital world. COVID has accelerated the pace of digital transformation and exacerbated the risk of increased inequities and exclusion of those who are not digitally connected, as there is not necessarily equitable access to technology and digital mediums. This may increase inequities for vulnerable groups. Thus, when leveraging virtual and digital services, we need to ensure that no one is left behind or left on offline. Although technology generally connects the majority, it can create a greater disconnect for those who do not have equitable access to these technological resources. Thus, consider ways to address and acknowledge the following: access, affordability, skills, and awareness, as well as relevance of online content. Now, moving forward, we'll look at the changing family context. Now, again, as stated throughout, everyone has been impacted by the pandemic. For some, the pandemic has led to increased demands, and for others, perhaps decreased demands and stresses. Historically, and throughout the pandemic, the health workforce can be the first line of reliable support for patients and family caregivers. From a patient and family-centered approach, it's important to consider the impact on not only the patient, but also their family or household members. Now, these individuals might also be or become caregivers or sole breadwinners. We cannot forget to consider the family, their impact, as well as how they may be impacted by the recovery journey. Thus, if we loop back to the idea of income as a social determinant of health, how has COVID impacted the income of other members of the household? Interestingly enough, not all stress creates distress, but there is a potential for change and potential disruption to what was once normal within the home or family. Now, if we consider the client's social context and impacts, there's a strong body of evidence that supports the impact of social determinants of health on health outcomes. Remember to ask individuals about their individual experiences and not assume that everyone is experiencing the same thing just because they are part of the same family or home. Ask clients about their barriers to services. For example, income, transportation, social and community resources, digital literacy, and technological access. As well, consider your own services and if they facilitate access to service for all clients. This can include hours, delivery mode, and cost for extras, extra supplies, extra equipment. And lastly, consider changes within the family system as a result of post-COVID symptoms and ask about family and caregiver needs. Assumptions can create more barriers. Thus, awareness of same can be instrumental and allow space for a more authentic and meaningful working relationship. As healthcare providers, we are entering patients and families' lives at one of the most vulnerable times in their life. Thus, it's important that we be aware of this great privilege and any assumptions that we might hold. Now, before I pass it over here to Deb, I just wanted to highlight a few resources. I think individuals on the call or others, when they look over the resources, might really find these resources. Again, these are just a snapshot, but from a social impact perspective. The tools in the links are useful guides that can support and help support clinical practice when exploring poverty and social history, as well as support a better understanding of the social determinants of health and how we can support caregivers. So I would just like to thank you for your time and pass it over to Deborah.
Thank you, Andrea, very much for that. I really appreciate that. So just hang with me for just a sec while I move it over. That would be great. Oops. So I'm going to talk about occupational therapy very briefly and then go through a case study. Sorry, I had it on the right. So in help people with post-COVID, the social emotional impacts of occupational disruption. Really, we know these people, they've got isolation, they're lonely, there's changes in mood, there's loss of meaning and connection, and they're really experiencing health inequities at times, facing economic instability and changes in their family system. And with all of these issues, it's really not hard to understand that it influences a person's daily routines. And those things that they need to do and want to do that are really meaningful to them, occupations, they may be disrupted. They may be experiencing a role loss. And as you know, your roles often really inform your identity. And so it can really impact on your identity as well. For example, they may not be able to work and they may need a family member's support and help to do things. That really changes roles and how they see themselves. Individuals may also have feelings of frustration and vulnerability as they begin to see themselves differently and may experience a change in their values and their priorities. In particular with post-COVID, both providers and clients may feel this uncertainty about just recovery timelines, and the recovery progress is so variable, and this causes additional distress because at times they're not seeing change and the progress that they're hoping for. So OTs working in this area are spending significant amounts of time working through those psychosocial issues in order to help their clients participate in those things that are meaningful to them. These factors need to be addressed in order to help a client move forward in their recovery. It's difficult to help a client to set realistic functional goals when they believe that they should be further along, they should be back to work, yet they're having problems even doing their own self-care in the morning. And because the course of the recovery is marked by fluctuations and abilities, it's important to be coaching a person around disappointment and fear and discouragement, because some days they're able to do things, some days they're not. And it's really important for OTs to know when they can address the issue with the person themselves or when they need to refer to another healthcare professional. And so I'm going to share an example. And this is a lady that was seen by, and some modifications in it, of course, by an OT. And Ruth is a 53-year-old woman who identifies as female. She was diagnosed in October 2020 and is in active treatment now as we speak, but was never hospitalized. And this was a very high functioning lady. She, type A personality, very active in sports. And so normally a real go-getter, worked in the education system, and there just was no history of any kind of mental health issues in the past. The symptoms that she's still struggling with is fatigue, pain, anxiety, and brain fog. And there's lots of things that she was having difficulty doing. Meal prep, gardening, intimacy was a difficulty. The sports that she enjoyed doing before was hard. And particularly caring for grandchildren, very significant thing that she enjoyed doing. And of course, working and driving. Sorry. And, so psychological factors, significant anxiety. She was saying, like, the longer I'm sick, I'm just not like myself, the more anxious I get. Driving, she was limiting her driving because of that anxiety. She admitted she was worrying a lot. She had a lot of difficulty, obviously, accepting the changes in her function, and really had a lot of fears about her future because she was so active before and now really struggling with being active. Social factors, there was an increased financial strain because obviously she was working before. really just what her ability to do her workload had the abilities had changed, and also those changes in supports, and finding that some of her friends were really having a hard time understanding why she isn't as active as she was before, and then these concerns about accessing, the resources that she needed. And spiritual factors, she says, I don't feel like myself. I normally can cope with things, and of course, feeling like she wasn't coping so well anymore. So how do we incorporate those psychological, spiritual, and social consideration? And what has already been stated is just your own level of comfort and discomfort as you engage with the client and their story. And you heard Zinnia talk about compassion and what that meant of entering into somebody's story is really that yourself, you need to be exercising that self-care, because you can well imagine if you're actively trying to help somebody and you yourself are already in distress, it's going to be very hard. And then, establishing that caring connection and normalizing your experience with that trauma-informed manner is so important. And inquiring is like, what matters to them rather than what's a matter with them, right? But it's providing that space for them to tell the story. So sometimes as occupational therapists, we're, okay, Ruth, what do we want to do today? What do you want to set as a goal for next week? It's so tempting to kind of get on with the business of setting those goals, but it's really needed to step back and enter into the story. How has the last week been? How was yesterday? Knowing that sometimes it's going to be very variable, and listening and being aware of those concerns, such as income security, anxiety and depression, distress around role loss, and the inabilities to engage in those things. So with Ruth, that distress around not being able to care for her grandchildren, that her anxiety was higher last week with her driving, that she couldn't drive at all. So how did she get to places? And then really moving into those strengths. So Ruth was a lady with a lot of strengths, a lot of abilities. And so how do we leverage those? How do we move her into that place where getting those tools to continue on her journey? And then really supporting strategies around for stress and mood management. And you heard Lana talk about this, about reframing those thoughts to be more positive and hopeful. And you can well imagine that if Ruth is feeling like she can't do anything, that negative thought process is really not going to help you. Something that really struck me that Lana said is helping them believe that they can do what they need to do. And so very, very impactful if they have that self-efficacy, that they feel that they can engage in those things, as well as setting a context of reachable goals with realistic expectations, which is tough because it's a moving target. It can move literally from day to day. And being able to understand that that's maybe part of her recovery. Also, something that I believe Zinnia spoke to is, and Lana, is it really engaging those pleasurable activities and goals. So someone like Ruth, it wouldn't be hard to imagine as well, I need to get back to work. I need to be supporting my family. Whereas maybe really what would help her wellness and her recovery is actually those things that really give her a lot of pleasure and joy in her life, would really help her recover a lot faster, like playing with her grandchildren. Activity logs is something also that can be helpful to give concrete evidence that there really has been progress, even though it doesn't look like it. Especially when maybe Ruth gets very discouraged when there are those setbacks. And supporting that return for Ruth's normal life activities will really have to include addressing the memory and the concentration as well. Because you can well imagine at 53, the distress that would be associated with not being able to remember things and not being able to think. And so facilitating the use of memory aids, including the use of routines, because routines themselves decrease that cognitive and physical demand. And in clinical practice, it's really mindful we need to be mindful for the need to consider further resources and when a referral is required. So from a psychological perspective, if there's a concern that the patient or families are challenged with coping, and if there's indications of anxiety, depression, and distress or trauma, or in terms of cognition, sleep, or pain being a concern, a referral to a psychologist may be appropriate. The sources of concern or distress can be from any source or many sources. And it's through that collaboration with the client themselves that addressing the needs and facilitating wellness and growth occurs. And from a spiritual care perspective, if the patient continues to have difficulty with anxiety, lamenting or grieving her sense of loss and distress or trauma, a referral to a spiritual health practitioner may be appropriate. The practitioner will work with the patient in a variety of ways to compassionately to support the building of the patient's spiritual resiliency. That is the ability to sustain a sense of self and purpose that's able to hold the tension of both a disrupted sense of self, like that spiritual distress, and the sense of a belief in herself that remains intact. And so remember, Ruth says, I don't feel like myself. And so spiritual health practitioner would be very helpful to try reconcile that. From a social perspective, it's important to look at the person and their environment, as well as the social determinants of health that can impact a person's health journey and recovery. Furthermore, it's important to be cognizant of the shared and individual impacts the health journey and recovery has on the family and the household in general. By creating linkages and equitable access to information and potential resources, social work practitioners in healthcare can really help a patient and their identified supports navigate options and opportunities that could benefit their recovery. So providing the patient with the tools, knowledge, and support to be an active participant and leader in their ongoing health journey. And so I'm going to hand it over to Laura to finish us up. Would you like to take this screen, Laura?
Actually, I was going to ask you if you're okay to
Sure.
just continue sharing. And
I sure can.
Thank you. So yes, for more information, please check the websites, and they were in the chat box as well. And also want to remind you on the next slide that there are physiotherapists and occupational therapists available 5 days a week to help providers and patients who have questions related to rehabilitation needs. And as well, the mental health line is available 24 hours a day, 7 days a week to offer confidential support, information, and support referrals. And next week's session will focus on neurocognitive sequelae, functional cognition, and cognitive communication. We hope to see you there. I think we only have time for one quick question. And this is for anyone, but can any of the speakers speak to the social stigma of clients who continue to have a chronic cough and who are wanting to go back out into public but are feeling judged?
Maybe I can start us off and recognize that's a great question. And I think, unfortunately, a very normal question, because I think many have experienced those same thoughts. And I don't know if there's a way, from that social impact perspective, a way to minimize that stigma or the feelings of stigma, but recognizing, if the individual has reached out to their healthcare team and is aware of their own health, I think from that strength-based approach to know about their health and wellness. Unfortunately, we cannot control other people's thoughts, but it may not, again, alleviate the stress that it may cause when maybe, someone feels that they're being looked at differently, or they feel that eyes are on them when they do have that cough. But I think, information is a powerful resource, and again, working with that medical team to know what is a concern and what isn't from a medical standpoint, maybe will help fill that toolbox for individuals.
And just to add, from a spiritual care perspective, or really a trauma-informed perspective, building on what you're saying, Andrea, that to recognize that that's a trigger that can get you out of that window of tolerance, and to somehow bring us back to that window of tolerance, maybe to engage some of those practices, grounding exercises or spiritual practices, breathing, just to help the person get back into more of a connected place with themselves.
Thank you. And I'll just maybe add to, I think it's such a good comment that how we can't control the environment. We can't control what others might be thinking or feeling. But if we're aware that we're safe, and we're aware that we're right. It's maybe that's the place to think about, also think about adding where we can develop statements, self-statements to remind ourselves that it's okay, that we're okay to be out, and it's okay if people might look skittish, or we might see some reactions where people seem nervous, but we can manage that. So just that we're still, just sort of reassuring ourselves that we know how we're feeling. It's okay if some people might be concerned, and maybe we can kind of even get that, maybe, right? But that we're okay with that, and we can manage that.
Thank you. Thanks for the responses, and thank you so much to our speakers today. It was a lovely session, and that reminder of everyone has experienced trauma and stress and anxiety this year, and if we address our work with that in mind, and we'll not only help ourselves, but we'll be better supports for our patients. So thank you very much, everyone. And we look forward to next week's session. Have a good day, everyone.
Thank you, everyone.